Okay, in part 2 of module 4, we're going to have a look at some Metagenics product solutions for metabolic syndrome and type 2 diabetes. Now, I'm sure you're all aware that conventional medical approaches usually require multiple medications in order to manage each of the risk factors. So patients would usually end up getting a tablet for their blood pressure and something for their blood sugar, something for cholesterol, and the list goes on and on. However, none of these approaches are actually addressing the reason why those markers are abnormal. But with Metagenics formulas, we're able to offer comprehensive approaches that specifically target the different stages of metabolic syndrome and blood sugar dysregulation, as well as cardiovascular risk factors. So we have specific therapeutic options that give you the ability to target the therapy to the specific stage of metabolic syndrome and therefore obtain improved results with fewer products. So let's start by looking at Ultrameal Original. This is a medical food that's used to address basic body composition concerns. It's a low glycemic meal replacement shake, providing 15 grams of soy protein per serving, as well as a blend of foundational nutrients. One particular highlight in those nutrients is the inclusion of 400 milligrams of actifolate, which is made up of a blend of 3 different folate types, one of them being L5-MTHF, methylated folate, which is a great bioavailable form of the folate. So this product, Ultrameal Original, is available in 3 different sizes. And now I just want to spend a little time looking at the issue of the soy protein and why we've specifically selected to utilize the soy. And basically one of the aspects that make it a good protein choice is that it's been found to support body composition. And we make sure that we utilize non-genetically modified, identity-preserved soy protein so that we've got a safe source of soy isoflavones. The FDA has actually stated that 25 grams of soy protein per day can actually reduce the risk of heart disease. And there have been numerous controlled human clinical trials that have found that soy foods are beneficial for overall heart health. There was actually a meta-analysis of 38 controlled clinical trials, which concluded that the consumption of soy protein rather than animal protein significantly decreased serum concentrations of total cholesterol, LDL cholesterol, and triglycerides in hypercholesterolemic individuals. Now, soy is often considered a human food allergen or a frequent human food allergen, and it's included on the list of foods that people tend to react to. But based on a review of human clinical and animal model data, it was found that soy proteins actually tend to be less reactive than many other food proteins. In fact, soy has been used as an alternative for infants with allergies to cow's milk with relative success. You can see a reference there also to a meta-analysis of 17 studies of allergy patterns of high-risk infants, where they found that soy allergy occurred in only 1% of the subjects versus 25% for cow's milk. So unless the patient is highly sensitive or allergic to soy protein, most of them can safely incorporate moderate amounts of soy into their diets. Now, yet another contentious issue is whether soy has any impact on thyroid function. Well, the answer to that is not in healthy individuals. However, if patients have existing thyroid issues, some studies have suggested that there may be inhibition of thyroid hormones. Individuals who have a history of thyroiditis or consume a diet marginally deficient in iodine may also be more susceptible to these effects. But the vast majority of patients will actually benefit from the use of soy for issues related to cardiovascular health, body composition, as well as menopausal issues. Is soy beneficial for breast health? Well, much of the controversy surrounding isoflavones and breast health comes from the in vitro studies with isoflavones, which are considered to be phytoestrogens due to their estrogen-like effects. However, the biological effects of isoflavones have been shown to differ markedly from estrogen. One of the main differences is the ability of these isoflavones to preferentially bind to one of the two estrogen receptors, whereas estrogen binds robustly to both receptors. So the isoflavones actually have a protective effect on estrogen-sensitive tissues. While there has been much discussion on whether women with estrogen receptor-positive tumors should avoid isolated soy components, the answer to that question has not been confirmed by research. So data is far from conclusive on this issue, and as a result, researchers are urging caution for women with active estrogen-dependent cancer. Now, in men, there has also been concern as to whether soy consumption might lead to infertility by decreasing semen quality. A review of 4 published clinical trials investigating the effects of soy isoflavone consumption in men reported that there are no adverse effects of soy isoflavone consumption on sperm quality, while another study found that consumption of soy isoflavone supplements at the level of 40 milligrams daily had no effect on semen quality. It is also worthwhile to note that based on a variety of studies, it's been suggested that soy consumption may actually reduce prostate cancer risk without any significant adverse effects. And so for that reason, the Ultra Meal Original family of medical foods comes in a variety of options. You'll see listed at the top the Ultra Meal with a soy protein source, which is available in 2 flavors, vanilla and strawberry. And then we've also got Ultra Meal Whey and Ultra Meal Rice, both of them being good options. The whey, very nice for addressing lean body mass and body composition. We have that available in only 1 flavor, vanilla. Well, the Ultra Meal Rice is a very popular choice for anyone with potential soy or whey allergies, and that's available in 2 different flavors, the chocolate and vanilla. So now let's look a little bit about what makes the Ultra Meal Original such a good choice. What makes it different is that it's actually been clinically demonstrated to not only promote weight loss, but to promote the right kind of weight loss. So if you look at the study tabulated over here, what we did is we compared an arm of patients, so a group of patients that were under the doctor-supervised Ultra Meal food program, and then in the other group, they were utilizing a regular over-the-counter shake and doing their own weight loss. And you can see that both groups had a significant amount of weight lost. But where the difference comes in is when you actually look at the fat that was lost. And you can only really assess this by looking at body composition. So you can see that there was significantly more fat lost in the Ultra Meal doctor-supervised arm when you compare it to the over-the-counter weight loss group. So you have to wonder where the rest of the weight was lost in the over-the-counter group. If it wasn't coming from the fat compartment, was it coming from the fluid or the muscle? Another side effect that was picked up in this particular study was that the over-the-counter group showed a statistically significant change in TSH levels, that's thyroid stimulating hormone. It was a 150% increase, while there was no such change in the Ultra Meal group, showing that the Ultra Meal did not have a negative impact on thyroid function. So really what makes the Ultra Meal so impressive is that it was actually demonstrated to show an anabolic effect on lean body mass whilst promoting concurrent loss of fat. So here they looked at previous sedentary overweight women. There were 18 overweight women, and they were placed on the Ultra Meal program for 7 weeks. That included dietary changes, exercise, and in 7 weeks you can see the tremendous results that were obtained. Not only did they lose weight, but the majority of the weight that was lost came from the fat mass compartment, with an average fat loss of 6.4 kgs. And even better, there was an increase in the lean body mass compartment. You can see there it's referenced 0.2 up to 3.5 kgs in some individuals. We do have another version of the Ultra Meal medical food called Ultra Meal Plus. And what makes this slightly different is that in addition to the soy protein, it has also got 2 grams of plant sterols per serving. Now, plant sterols have been known to promote healthy cholesterol levels. So the Ultra Meal Plus is really indicated for those patients with metabolic syndrome that are now starting to exhibit cardiovascular disease risk factors as well. So for those of you that are not that familiar with plant sterols, they are substances that occur naturally in small amounts in grains, vegetables, fruits, legumes, nuts, and seeds. And what they do is they help to block the absorption of cholesterol. And studies have shown that 1.3 grams per day are needed to show significant cholesterol lowering effects. This extract from the American Journal of Clinical Nutrition states that 1.8 grams of sterols per day was able to reduce LDL cholesterol by 11.3%, as well as reduce cholesterol absorption by 56%. Another study from the same journal recommends 2 grams of plant sterols daily as a way to reduce the risk of coronary heart disease by a whopping 25%. And that soy protein, together with sterols, is a practical and safe alternative for patients seeking to reduce LDL cholesterol. What's interesting is that human clinical trials have demonstrated that the Ultra Meal Plus is even better than the conventional American Heart Association diet when it comes to reducing cardiovascular risk factors. Here you can see how when the Ultra Meal Plus is used in conjunction with the low glycemic load eating plan, it effectively reduced total cholesterol, LDL, triglycerides, and body weight much more than the American Heart Association diet. In addition, HDL levels were more positively affected. Some of the other markers that improved more dramatically were the high sensitivity CRP levels as well as fasting insulin. So overall, the Ultra Meal Plus group did much better. Now, in the previous module, we have talked a little bit about SCRMs and how they play a role in insulin signaling. Now, if you recall, essentially a trigger will set off kinase activity, and you can see the specific kinases involved. There's GSK3 and IKK, and this, when they're operating normally, it allows for the insulin receptors to receive the insulin and ultimately for the glucose to enter the cell. Now, it's overactivation of those kinases which is problematic and drives insulin resistance. We have identified 2 botanicals. They're specialized extracts. You might recall reduced iso-alpha acids, or RIA for short, and acacia, which are selective kinase response modulators. And they directly modulate the GSK3 and the IKK, and therefore stop the inflammatory process and indirectly improve insulin response. Now, we've tested these SCRMs, the RIA and the acacia blend, at our Functional Medicine Research Center, where we looked at important clinical markers. We basically assessed the effect that blend had on the 2-hour insulin and glucose levels, and we also assessed overall insulin sensitivity, and we found great improvements and great changes from baseline when administering the RIA acacia blend. We also looked at triglyceride levels and noticed, you'll see that the study was done over 8 weeks, a tremendous improvement over placebo in the triglyceride levels as well. Another study was conducted to look how the RIA acacia blend compared in efficacy to two of the most popular conventional therapies. And essentially, here you can see that the blend had similar or even superior results in the reduction of both serum glucose and serum insulin levels. Now imagine having a solution for your patients that works as well as the drugs, but without the side effects. This is an extract from a research article. As you can see, it's a double-blind, placebo-controlled trial examining the effects of rhea acacia supplementation on insulin homeostasis. This article is available from your AMI Pro rep, and you can see summarized some of the statistically significant results that were obtained. Improvements in triglyceride levels, fasting insulin, as well as 2-hour postprandial insulin, fasting and 2-hour postprandial glucose levels, and the triglyceride HDL ratio. So really impressive results from this formula, clinically tested and available in a nutraceutical option called Insinase. Insinase provides the SCRM's rhea and acacia for improving insulin function. One tablet can be taken daily with meals and is an effective way to balance the kinases and help maintain healthy blood sugar and triglyceride regulation. Now, another medical food that forms part of the Ultrameal family is the Ultrameal Plus 360, which is quite unique in that it incorporates the SCRM component together with the benefits of the Ultrameal medical food, making it an excellent choice for patients with metabolic syndrome, and it has been confirmed in 2 clinical studies that it is able to reduce total cholesterol as well as LDL, triglycerides, and improve the ApoB-A1 ratio. Now, the main paper of one of the studies was published in the Journal of Clinical Lipidology, and it highlighted the benefits that the Ultrameal Plus 360 had with regards to lipoprotein metabolism. The clinical trial took place at 3 universities: the University of California, Florida, and Connecticut. There were 89 women with metabolic syndrome in a randomized 12-week trial. The control arm was on the FLT food plan, which is a low glycemic load Mediterranean eating plan, and baseline exercise. And the treatment group was with the same food plan, with the same baseline exercise. However, they had the addition of 2 servings of the Ultrameal Plus 360 per day. And what can be seen is a significant benefit from adding the Ultrameal Plus 360. 44% of the patients resolved their metabolic syndrome. Weight change was similar in the 2 groups. And this is good because the benefits in the other parameters cannot be contributed to additional weight loss. But what we did see was significant better improvements in the triglycerides, the LDL cholesterol, the total cholesterol, and the ApoB. The triglycerides are really impressive for a 12-week program. In this article, entitled Optimal Treatments for Metabolic Syndrome, it states that using a lifestyle program, mainly the Mediterranean-style diet, showed that there was a 48% reduction in metabolic syndrome over 2 years. Now, if you recall back to the previous study, there was a 44% reduction in metabolic syndrome in just 12 weeks by adding the Ultrameal Plus 360. So that's quite significant. This is another study published in Nutrition and Metabolism, which confirms the previous study results, and it followed the same outline. Basically, we have the control arm, which is just the diet and exercise, and the treatment arm, which is the inclusion of the Ultrameal Plus 360 twice a day. And as you can see, consistently better results are obtained in the treatment arm. Just look at the triglyceride levels. When the results of that study was analyzed by looking at a subgroup of the patients who had the more elevated risk factors, it was found that they benefited more profoundly from the medical food plan. So you want to consider using something like Ultramil Plus 360 with your patients that are more at risk, that have the higher risk markers, to really get them out of that danger zone faster. This is a nice slide that essentially compares just how effective the Ultramil Plus 360 and diet is compared to other conventional approaches. So there you can see statins, anti-diabetic agents like metformin, triglyceride reduction like niacin and fibrates. So what's unique about the Ultramil Plus 360 is not only that it's more effective than many of those other conventional approaches, but that it's also effective across many different risk factors simultaneously, and very importantly, has no side effects. Look at the side effects associated with statins and metformin and fibrates, for example. So the Ultramil Plus 360 program is very easy to implement. We have patient guidebooks, which you can provide to your patients, which outline the eating plan, which is based on a modified Mediterranean diet, and shows you how to effectively incorporate the selected medical food twice daily. So remember, we've got a number of options in the Ultramil range. The Ultramil Plus 360 is a soy-based medical food, which is perfect for your more advanced metabolic syndrome patients with cardiovascular disease risk factors. But then we also have an Ultramil Plus 360 rice option, for the very reason that you may not want to use soy in a selected patient population. Remember, the Ultramil Plus is an excellent alternative for any of your patients that are on blood thinning medications, because as mentioned before, SCRMs are contraindicated on medications such as Coumadin and warfarin. So the Ultramil Plus would be a great alternative. Now let's look at another medical food, Glycemics 360, which has been specifically designed for patients with established type 2 diabetes. Glycemics 360 is a low glycemic index, soy-based medical food with specialized support for patients with diabetes. It's designed to improve glucose and insulin levels, as well as decrease total cholesterol and triglyceride levels. The Glycemics 360 medical food provides 15 grams of non-GMO soy protein per serving, together with specific SCRMs that modulate insulin sensitivity and 2 grams of plant sterols to help with insulin function and lipid levels. It also provides therapeutic levels of cinnamon to help improve insulin sensitivity, and it also includes chromium, biotin, and magnesium to promote healthy glucose metabolism and insulin function. Now, just to recap, cinnamon is backed by a lot of research as being a highly specialized nutrient in reducing serum glucose, triglycerides, LDL, and total cholesterol in your type 2 diabetes patients. And chromium and biotin improve insulin sensitivity and glucose metabolism in your type 2 diabetics as well. Keep in mind that whilst on the medical food program, it's advised that patients be monitored as dosages for their medications and their blood sugar lowering meds specifically may need to be lowered over time. Glycemics 360 is easy to integrate into a therapeutic lifestyle change program and can be used together with the blood sugar patient guidebook, which is available from your AMI Pro Rep, or you can check in your toolkit as well. We do also offer another medical food for type 2 diabetics that does not contain SCRMs. It's called the ultra glycemic medical food. And of course, this would be an appropriate alternative for those type 2 diabetic patients who are on blood thinning meds. So just keep this one in mind. So it's exactly the same, just without the SCRMs. So here's an example of the case study conducted at our Functional Medicine Research Center. A 62-year-old lady with obesity, hypertension, and type 2 diabetes, suffering from daytime fatigue and sleeping issues, currently on metformin for blood sugar management. And after just 10 weeks on Glycemics 360, with the right eating plan, you can see the dramatic improvements in her risk markers. 50% reduction in fasting blood glucose, 44% decrease in triglycerides, and a 31% decrease in her HbA1c in only 10 weeks. So for patients with type 2 diabetes, consider the appropriate medical food, ultraglycemics or Glycemics 360, with or without the addition of the SCRMs, so you can choose to either add the incinase in or not, and then additional supportive nutrients, which can be added to round off the protocol. So here we would look at things like cinnamon, green tea, B vitamins, alpha-lipoic acid, and fenugreek. So one very comprehensive nutraceutical option is a formula called Metaglycemics. This is a scientifically advanced formula to be used as nutritional support along with a healthy diet to help maintain healthy insulin and glucose levels. It basically combines a comprehensive vitamin and mineral profile, including B vitamins, chromium, biotin, and magnesium, as well as specific nutrients like alpha-lipoic acid, cinnamon, and green tea catechins. So you would utilize the Metaglycemics by taking anywhere from 2 to 6 tablets daily with meals. If you're looking for a high-potency alpha-lipoic acid formula, Metalipoate provides 300 milligrams of high-quality alpha-lipoic acid per tablet. This provides antioxidant activity in both aqueous and fatty regions of the cell and may cross the blood-brain barrier and extends the functional capacities for vitamin C, E, and coenzyme Q10, and will also directly scavenge free radicals. As you've also seen previously, it plays an effective role in improving glucose metabolism, so it really is an excellent choice. And I know that one of the main applications of Metalipoate would be for diabetic neuropathy, as it plays a role in healthy nerves. Fenugreek Plus is a herbal supplement that can help to support the metabolism of glucose in the blood and thereby help with a healthy blood sugar level. This potent herbal formula contains high-grade concentrated extracts of fenugreek, gymnema, and bittergourd, or bitter melon. These 3 herbs are proven to metabolize glucose in the blood. Studies have revealed that diabetes patients experienced significant decreases in their blood sugar level after the intake of fenugreek. It concluded that a diabetic patient needs at least 1,000 milligrams of the herb daily, which is what you'll get in 2 capsules. So gymnema also helps to lower blood glucose levels, and most significantly, it helps to reduce people's sugar cravings. Bitter melon is also a common type of vegetation in India, and it acts as a natural insulin in the body, lowering glucose levels in the blood and urine of diabetic patients. So this is a pleasantly odorless formula, and patients are advised to take 2 capsules 2 times a day before meals. And it's best to drink this herbal supplement with a cup of water. Now, if you're looking for a nice comprehensive option, the Wellness Essentials Healthy Balance is a convenient way to provide your patients with both foundational and targeted nutritional support for their blood sugar balance in a 1-a-day packet. So each packet provides 1 phytomulti a smart multi with generous levels of foundational vitamins and minerals, as well as standardized extracts of phytonutrients. It is then combined with 2 of the metaglycemics tablets, which, if you recall, contain chromium, green tea, and cinnamon, as well as alpha lipoic acid. There's additional 100 milligrams of metalipoate and 2 soft gels of our purity certified omega-3 EPA-DHA extra strength, providing 1,000 milligrams of the EPA-DHA in total. So that's really a nice, convenient choice. So as you can see, Metagenics has a number of clinically effective and targeted options to help get your patients with blood sugar concerns or metabolic syndrome or cardiovascular disease or even type 2 diabetes back on track. And that brings me to the end of Module 4. Thanks.